welcome to Ottawa Experts. I'm your host, Barbara Balfour, and on tonight's show we'll be talking about how to take care of your skin from the inside and out, especially as we head into the summer months. First, we'll be talking about some great over-the-counter products and simple ways to take care of your skin at any age, whether you're at home or out and about, from sunscreen to exfoliators and moisturizers and everything in between. Joining us tonight is a special guest, Beata Zwolon, who is a beauty boutique manager at Shoppers Drug Mart. Hello. Thank you so much for joining us tonight. You work at the Findlay Creek location on Bank Street South, and you're an esthetician, a makeup artist, you're a teacher, and you're also a cancer survivor. So you'll be talking to us later on in the show about some ways to eat and drink your way to better health. Sure. Looking forward to looking at some of your favorite products from Shoppers that you've brought to show us today. And you're also giving away most of them, a very generous giveaway. What's the value of the package that you're giving?
$500.
$500 value. Yeah, I would like to be a viewer tonight for sure. And next we have Diane Lagana, who is co-owner and operator at Ever Radiant Medical Cosmetic Laser Clinic in Manotick. Thanks so much for joining us.
Thanks for having me.
You'll be talking to us about some of your own favorite products that you've brought to show us here today, but also what your options are when over-the-counter products are no longer enough, and some of the procedures and appointment-based therapies that are available at your clinic. So thanks again for coming in. And later on in the show, we'll be joined by a very special guest, Dr. Joelle Villeneuve, who is a naturopath and director at the Revivelife Clinic, who recently actually wrote a book on how to drink and eat your way to better skin care. So she'll be talking to us about top power foods, supplements, and detoxification, so make sure you stay tuned for that last segment of the show. So as I mentioned to our viewers, tonight is your lucky night. We've got lots of giveaways. We've got so much to give away, in fact, that we didn't have room for it on the table. Sephora actually sent us two fantastic care packages to give away, one by the brand Philosophy, and another is sort of an assortment of products, also valued at hundreds of dollars. So there's those two packages from Sephora available for giveaway tonight. There is, of course, Beata's package that's valued at $500 from Shoppers Drug Mart, and that's an assortment of goodies for men and for women. And Diane, you're also giving something away tonight.
I am the Oxygen Now 3-in-1 Superfacial,
which is something that you can do in the summertime, because
absolutely.
I know there's some procedures that you need to steer clear from when you're going to be getting a lot of sun, but this is not one of them.
This is not one of them. Great for everyone. Everybody.
Great. So if you want a shot at winning any of those products tonight, make sure you call 613-759-8622. That's 613-759-8622, and you just have to be willing to come to our studios at 475 Richmond Road in Westboro to pick them up. So good luck with that tonight. And also, if you have any questions for our guests about skincare and procedures and so on tonight, make sure you call the number on your screen. They're excited to hear from you. So, thank you, Beata, once again, for the gift package. I want to hear about some of your favorite products and how they tie into some of the basics on skincare. So, cleansing, moisturizing, exfoliating. But before we get into the specifics, I want to pose this question to both of you ladies. What percentage of good skin is based on genetics, and what percentage is based on hard work of skincare?
I would say 20%. Genetics, 80% hard work.
And what do you base that on?
Basically, the patients that I see, sometimes I'll have patients that are like 69 years old, they look like they're 50, and they say, oh, my mother never had a wrinkle. So really, genetic plays a large role into that. Then I might have patients in their late 30s, and they look way older. So lifestyle has a lot to do with it also.
Not smoking, not drinking too much.
Not smoking, drinking, eating well, keeping hydrated plays a large role.
Sleep, your stress, sleeping.
Absolutely.
Once in a while I hear some Hollywood movie star say something really annoying like, I never wash my face and I never do anything and my skin is naturally that good. Is she lying?
Absolutely.
Yes.
Absolutely. That's the biggest mistake of the skin, not to take care of that, not to remove the makeup at night.
Not to remove the makeup at night. Okay, so Beata, take us through some of the basics. What are some of the basic skincare steps everyone needs to know at any age?
Well, skin is the biggest organ. And then we really have to take care of the skin. There is few different steps basic that we have to take care of it. First of all, we have to determine what skin type we have. And we at Shoppers Drug Mart have a lots of experts that can help to determine the skin type. We have a computer that can determine the skin moisture level and then damage.
Is that when they just put a sticker on your skin, or how does that work?
Yes.
Okay.
Yes. And then we also have a computer that it can determine the damage, sun damage of the skin, and we can determine the appropriate skin type and then appropriate regime for that. And also for all the girls are very knowledgeable, and we have variety of products that we can propose for that.
Okay, so take us through some of your favorites that you've brought in with us
Well,
today.
first for skin's routine, it would be the cleanse, and we have a few products to cleanse the skin. And then I brought the
Clinique Sonic System. So it
Clinique.
looks like a giant toothbrush. I've seen it before.
Yes.
Is it as painful as it looks?
No, it's
Okay.
very popular products. We have it from Clinique, and then it's a brush basically that it helps to exfoliate the skin, and would also massage the skin, and would really, really deep cleanse the skin. So
Okay.
that's the first steps of proper skin
Do you have to
care.
do that every day?
You can do this every day, definitely, a few times a week, but the person that wears makeup, it will recommend it to do it every day.
Can you wash your face too much? Like, could you strip it if it's natural oils?
Dependent, I think, on the cleanser that one is using.
Okay.
So we have to be careful. So I have patients sometimes with rosacea. So we have a cleanser especially made for rosacea.
What is rosacea?
Rosacea is basically redness of the skin. People are flaring up sometimes, and they get like red all over the cheek area.
Okay.
And especially if they have a glass of wine, that may intensify.
Yeah.
Spicy food, that's another one. And basically facial capillaries go hand in hand with rosacea, so little broken vessels in the face. So that is rosacea. So, but it can be kept under bay. Proper cleansing, a toner, and also anti-redness cream, that sort of thing.
Okay. So after cleansing, Beata, what do you recommend?
You will tone your skin.
So I'm guilty of this. I don't have a toner. To me, you know, I'm busy. I've got a lot of things to do in my day. Am I making a mistake by skipping that step? Is that the most important step, or?
So what toner does, it's going to help to, it's like extra step to cleanse the skin, remove any residue of the makeup that might be after cleaning, and also would bring the skin to proper pH balance.
That's
And
right.
that is very important because then it's also next step, pre-step for the moisturizer.
Okay. So if I'm a guy and I don't wear makeup, that doesn't mean I can skip the toner.
Well, you could if you're a guy, you know,
Okay.
but it's
Guys have it easier and everything.
yes, exactly.
Yeah.
So.
And again, I think it depends. If somebody has acne,
Yeah.
they shouldn't like skip that step, right? They need to get the oils out and whatnot.
Yes,
So
that's
an astringent in that case would be more recommended as opposed to a toner.
Okay.
So I would recommend a toner for pretty much all skin type, but somebody that's acne prone, extra oil, astringent would probably be best suited.
Can a woman fluctuate between oily skin and dry skin, you know, depending on, you know, what's going on throughout the month, or whether she's going through a stressful period or
But
illness?
the skin type change, and it's all different factors that change the skin. It can be our age, so in younger age we can be a little bit on the drier side, and later on the skin more on the oily side, and then later on the skin become more dry. And also depend of stress, environment, different medication, different drugs to use it. The skin can really, really change. And so it's very important to have this consultation after a few years. We've come back again to Shoppers and have another consultation because the skin might change and your routine and regime can be totally different, and the creams that you're going to use it, you have to change the cream appropriate for your skin, because if not, you can do more damage to your skin as well.
If I find a cream that I really like and I'm using it every day or I'm using it every night, say until the end of that product, is it okay for me to buy the next tube of the same cream, or should I mix it up a bit? Is it, because people say that you should mix up your shampoo. You shouldn't stick to the same shampoo because your hair gets used to it. Does your skin get used to the same product?
I find for me, I like to use, depending on the season. So in the summertime, I'll use different products that I will use in the wintertime. So for example, in the summer, I will not use any product that has hydroquinone in there, tretinoid, retin-A, that sort of thing. So I like to switch it up a bit. And it's kind of shocking the skin a little bit, like making it wake up a tiny bit.
Yeah.
So it is similar, I guess, to shampoo, if you will.
Yeah, absolutely. You should change the skin during the season.
Okay. So what else do we need to know?
So the next step would be serum or moisturizer, and a lot of customers ask the question: should I use both? Should I use just the serum? Should I use moisturizer? Again, depends on the skin types, and the best scenario would be to use both. But the less complicated, if you can use only one product, would be serum. And serum is built with the smaller molecules. It will penetrate deeper into the skin. Usually it's a more like cocktail with the vitamins, and then it's the one that it really works. Cream will sit more on the surface, and it won't penetrate that deep into the skin because of the texture as
So
well.
is a serum like a...
It's like more of a correction too, right?
Yes,
so we apply the
exactly.
correction first, and if someone wants to use a moisturizer, they can go ahead and apply moisturizer on top.
What are you correcting with a serum?
Well, with vitamin C serum, we can correct hyperpigmentation very easily. The brown spot.
Okay.
It's also anti-aging.
Yes.
So there's CNE peptides sometimes you could find. So there's quite a bit that we can do with a serum.
So a serum is basically like a more potent version of a moisturizer.
Exactly.
So can
Exactly.
you replace a moisturizer with a serum?
I would not, personally. I wouldn't, because even though serums are great, it could be drying at times also. So you kind of need that little extra
boost.
moisture. Because more than likely, if someone is using a serum, is to do a correction, right? So let's say I have pigmentation, so I want to correct that, I'll use my serum. But it doesn't replace the hydration that I may need on my skin.
Okay.
So I think they work like hand in hand. They both do their jobs.
Okay, great. Okay, so we cleanse, we tone,
We moisturize,
We serum, we
and
moisturize.
right? Depends
Okay.
on the skin, and that would be daily regime using day and night.
Okay.
And we also have a weekly routine that is very important, because you can use the most expensive moisturizer or serum, let's say, and put on your skin, and then if you don't exfoliate your skin on a regular basis, the products, you really waste the products.
they just slide off your dead skin
Yes,
cells.
The skin, it's clogged and have dead skin cells on the surface, and nothing will penetrate. So that's why you have to exfoliate. And in the market or in Shoppers Drug Mart, we have a few different types of exfoliator, and it can be mechanical exfoliate, so it's the one with the grains. And there is also a chemical exfoliator.
So is that like plant acids, for example, or?
With AHA, and this is one from Stravectin that I brought from Shoppers Drug Mart. It's our star product. It's
What do you like about it?
it's like a spa in a box. You
Okay.
can use it by yourself. You have to be careful though, you not overuse and over exfoliate. I have to mention that during the summer season.
Especially in the summer. So is it safe to use this product in the summer?
Yes, but maybe instead of using once every 2 weeks, you will use it maybe once a month before a special occasion.
Okay.
And you really see amazing results of the skin.
And you probably have to slather on the sunscreen immediately after,
Yes,
right?
that's very important, and using the SPF.
Okay. So when would you use a chemical exfoliant versus a manual exfoliant?
It's really preferences. You know?
Okay.
Some people like to use the scrub, and some people like to use the. They both work really well.
Is there any exfoliant we can use every day?
There is a Clinique Shoppers 7-day scrub
Okay.
that we carry at Shoppers, and very good exfoliator. It's more gentle of your skin, but I will still recommend it to use maybe 2-3 times a
2-3
week.
times a week, yeah. I mean, you get addicted to that smooth feeling afterwards when you wash.
I think you know when you need an exfoliation, when you're applying your moisturizer and it's just sitting on top of your skin, it's just not penetrating. And dependent on the exfoliator that you're using, some of them can be very potent, so we have to be careful in not over exfoliating. I have clients sometimes that come in and they think they should do it every day,
Yeah.
and that's way too much. Dependent again on the product being used. The one that we carry in clinic once a week is ample.
Okay.
And then we also do exfoliation, of course, with like facial peels and stuff like that. But in the summertime, it's not a good idea to use medical grade facial peel.
And that's because that increases your risk of sunburn, right?
Not only that, it can promote hyperpigmentation, hypopigmentation, so the brown patches or the white patches on the face. So sometimes you see that little brown spot.
Yeah.
So we can get the white ones also. So we have to be very, very careful in the summertime with medical grade peels.
Yeah, skin become very photosensitive, so
Yeah.
you have
Exactly.
to really be careful.
Yeah. We've been talking a lot about the different steps and the different products, and I noticed, Beata, you brought in some products for men, which brings me to my next question. Most of the men I know would really rebel. Like if I said, you have to do this and this and this and this, they're not going to stand for it. So what's the compromise that you arrive at for your male clients who just don't want to be bothered, or even for your female clients who have busy lives, they're not morning people, the last thing they want to do is a sort of 12-step regimen. What are some compromises that you can arrive at for those
really
people?
The most important is to wash your face at
Okay.
night. the most important.
What I learned in kindergarten.
And just put a moisturizer. For men, very simple. So we have a lots of gel washing the face that the men can use it under the shower. We make very easy for them.
Okay.
And available. There's here number 7 products that I brought. That it's new products in Shoppers Drug Mart that we carry right now. It's a moisturizer for men with SPF 15.
Okay.
So that's also will protect
2 in
the
1.
skin.
Yeah.
Because the men's skin, it's as well important, like women's skin, of course. It's a little bit different. The men's skin that's thicker than men has a larger pores, and the women maybe mature a little bit gradually, and men at certain age the skin looks very young, and maybe when they turn around 40 years old, the skin starts all the wrinkles showing at once, and then they usually panic and come and look for the products that help them, but usually it's too late. But
Are you seeing more men come into your store?
of course,
Absolutely.
of course. We do consultation for women at Shoppers Drug Mart. It's all free. Our store in Findlay Creek that I work there full time. Anybody can come and then have free consultation of the skin, men and women. They can have a free makeup application. Some people don't know, but we offer that service on daily basis.
When did you start seeing more men come into the clinic?
I've noticed an increase probably in the last 4 years.
Okay.
And most people think that most of my clientele are female. 40% are male clients that come to the shop. So
That's a lot.
a huge increase. And although most of them like to keep it on the low down.
Okay, so there's still a little bit of stigma.
Yeah, there's always a little bit of stigma, but they're starting to feel more comfortable and they're more open. Keeping it simple for them is key. Not too many steps, something that's going to be effective, result-driven, then we're good.
Okay. I want to talk sunscreen. You know, this is the most important thing to keep it top of mind as we're heading into the summer and people are spending more time outside. Is sunscreen a product that you should splurge on?
Yes.
Sunscreen
to
is
say yes.
very, very important. Premature aging, one of the factors, it's not using the sunscreen. We can use the sunscreen for children from the age 6 months and up. Everybody should use it every day. Doesn't matter of the time of the year. Some people think that they can only use or have to use sunscreen during the summer or when they go outside the sun. The UVA and UVB rays really penetrate deeper into the skin, and they not only cause premature aging, they cause also cancer. And as we know, it's very important to take care of the skin. So sun protector, there is a lots of SPF in the market, and sometimes very confusing. People don't know what to use. I would recommend that minimum SPF 15. And 30. You don't necessarily have to use a very, very high number. What a number means, it means how long you can stay outside the sun without burning. So,
So
for
15
example,
times as much,
if
or-
it's SPF 15, it means if you stay outside the sun and then your skin starts burning after 10 minutes, times 15 will be, 150 minutes.
Okay.
You can stay without burning.
You need to reapply,
Yes,
literally
of course,
all the
you
time.
have to reapply. You have to put SPF half an hour before you go outside the sun. You have to make sure you not use any exfoliator that day.
Oh, don't use an exfoliator.
Yes,
Why not?
Exactly, because the skin become more photosensitive. That's what we
Exactly.
talk about
Okay,
that.
okay, okay.
And the other thing you want to look for is the ingredients, right? So zinc titanium base sunscreen. So if you don't have those two ingredients, the rays basically penetrates into your skin. But if you have the zinc titanium combined, it bounces off like a mirror almost. So less chance of pigmentation
So
and
it has
sun
to be broad
damage.
spectrum.
Yeah,
sunblock.
UVA and UVB.
Exactly.
Okay.
UVA it's for
Exactly, yeah.
aging and UVB for burning, but they both can cause cancer as well on the skin.